your graduate program is different from your intended area of practice, and the college may require you to do some more formal training and supervised experience to make sure you're competent to practice autonomously in your proposed area. So for example, if you were trained principally to do, and I'll take an example that's a more obvious difference, school psychology with children and adolescents, but you've ended up with a job working with adults in correctional services, the college would expect a huge retraining plan. So just be aware that to think about consistency, but continuous professional development is a part of professional life. So don't be afraid of the possibility that somewhere along the way your career may take a different turn. You'll be expected, though, to acquire the competencies for that. What I should mention is that in addition to the obvious courses in psychopathology, assessment, psychodiagnostics, intervention, which you would get in your graduate program here, the master's program in counseling psychology has the basic training required for psychological associate registration, and the doctoral program is accredited and does have the full scope of professional practice courses. The college also looks for foundational knowledge in individual differences, biological basis of behavior, social basis of behavior, and so on. So you'll find those on our website in the registration guidelines, or the registration handbook with the guidelines. And so be sure, if you didn't pick up that foundational training in your undergraduate degree, try to pick it up now while you're in your doctoral program, because it's easier to do now. Otherwise, if you have to get it after you graduate, it's a little harder to pick up those courses, although we will permit you to do it online for those specific courses, not professional practice type courses, but the foundational knowledge. So just to keep that in mind.
Can I just ask something about, because CPA accredits the doctoral programs, those foundational courses typically are the ones that you will have completed if you've gone to an accredited program, because there's a requirement that you either have done a course or established competency in biological basis of behavior, historical foundations of psychology, those sorts of things. I suppose it's possible to navigate through and have missed one, but you should be okay. The other thing, if I could just add one more thing around, graduating, deciding, where you're going to be and what you want to do. You also, the what you want to do is really important as well, because different professions will have a different scope of practice. So if you decide that you want to spend a career doing psychoeducational diagnostic assessments of kids, you want to make sure that you pursue licensure in an area that's going to allow you to do that. And I can't speak to what the scope is. I know a little bit more about psychology than I do about psychotherapy, but or a mental health therapist, but you just want to make sure that what you want to do, you can do with the title you pursue and achieve.
And sir, I should just mention, for psychological associate registration, the requirements are virtually the same, except it's a master's degree, and there's an additional 4 years of supervised experience you have to have before you then do the 1,500 hours of supervised experience overseen by the college. The examinations are the same.
So, for example, for some of our students are MED students, and our MA program, I think, gets you everything for the psych associate. But for our MED students, would they have to pursue extra courses, or what would be an individual basis?
They would have to have, and you'll have to look at our website to look at the specific requirements, but you should, if you can, get those extra courses before you complete the master's and get them recognized by your program so they show up on your transcript.
Any MED students with questions about that while we're on this subject?
And that's a hard thing to do, but the college doesn't allow augmentation of the degree itself. There are other kinds of things you can do after the degree, but you'll find the description of the degree requirements in our guidelines. And so you can't do a degree that doesn't meet the requirements and then add a bunch of stuff later. The college is really looking for an integrated sequence of study, and so if you need to pick up some other courses, you'll need to find a way to do that before you finish your degree.
Michelle, did you have some to add for requirements?
Well, they're not exactly the same requirements.
No, for yeah.
Okay, well, you sent me a lot of questions. I will answer the question. Possibly I will answer. It's already been said. At the CCPA, it's the Canadian Counseling and Psychotherapy Association. We're kind of a large spectrum of mainly the requirement is a master's degree in counseling, basically educational counseling, psychology counseling. We work in career development, counseling, education, school, counselor, pastoral, spiritual care, addict practitioner, creative arts, social justice, aboriginal counseling. So it's kind of a large spectrum. How many hours of supervision are necessary for registration? Well, it's 120 hours of direct client counseling, which means we kind of included the supervision inside the practicum. If you have a practicum, then it's all included. So we don't ask different hours from what we have in the practicum. And right now it's 120 hours. Are there any specific client population we should have experience working with? As you can see, no, it's kind of large. Professional designation within the association. Well, I talked to you about the CCC, which is the Canadian Certified Counselor, and you will find in the package how to become a CCC when you come at CCPA. The cost of the registration itself is $75 per student and $150 for membership year-round. And when you do your certification evaluation, it costs you $80. You were asking about length of registration. Well, membership is it must be renewed on a yearly basis. The certification is paid for a yearly basis. Certification period to compete with CAU is 3 years, and then you have to have 24 CAU within the 3 years. So that's how many hours of training or PD development you're doing in counseling. You were asking also about if there's any specific courses required for registration. Yes, there is. There's graduate courses, mainly in the master's degree level. And the following are mentioned inside the little booklet here. So it's counseling, communication skill, group counseling, theory of career development, assessment and testing, which I think you all have, research, evaluation, consultation methods, learning and human development, psychological education, counseling and prevention strategy, gender issue, multicultural counseling, counseling in specialized setting, and professional ethics. So 6 courses out of the following. Another question was, can courses taken outside of the degree count towards requirement? Not normally, but it could be considered in special cases. We don't have any psychological associate, that's for the Order of Psychologists. But we do have guest member who pay $130 a year. They don't exactly fit in the master's degree requirement. They don't have any vote in the association, but they can be part as a guest member to the association. It could be a teacher, it could be someone who has some interest within our association. And perhaps you would like to have further degree in counseling, and you can, we're looking at right now, trying to find some supervision and try to see if this person is looking for some supervision in counseling or private classes or whatever. Well, the transitional counsel will talk about, I guess, the requirement. She already talked about it a bit. Another question was, what should students keep in mind if they plan on moving to another province after their degree, or after gaining a certain number of hours as a psych associate?
Yeah, that's a question that I'd asked all of you. And you talked a little bit about the mobility between provinces. So, yeah, if all of you can kind of just speak to that a little bit. I know we have some students who are perhaps thinking of going home or going other places, and so how that works. And if you're registered in Ontario, do you have to re-register? And what is the process, that kind of thing for all of these? Go ahead. You want it?
Well, do you want us to finish in terms of the registration?
Sure.
We're a professional association, so we don't have any actual requirements. Anything that we do have would be in the brochure. Yeah, pretty much it. We have like different levels, but again, it's a professional association, so.
What I could add maybe to what I had said earlier is that, as you know, we will have 2 categories of membership: registered psychotherapists and registered mental health therapists, and the registration requirements will be different. What I outlined before was really the requirements for the psychotherapist category, because I think most of you are in a master's program, and if you were looking at our college, probably, I'm assuming you might be looking at the psychotherapist category. The registered mental health therapist category, when that was added to the legislation at the 11th hour, actually, it was a big surprise to a lot of people, and many wondered where did this come from, and who or what is a mental health therapist. We had to sort of figure out what that might look like. In the end, basically what we've decided, if you like, by looking at the range of people out there practicing and what they do in various sectors and the kinds of roles, so mental health therapists are probably people who work in an agency setting. They're probably an employee in a supervised situation, although not necessarily. And they probably do kinds of work that involves counseling and psychotherapy. Perhaps most of what they do is forms of counseling, and they, sometimes they do psychotherapy, or they use psychotherapeutic techniques. So some of them would call themselves various kinds of counselors, such as addiction counselors, or spiritual counselors, marriage and family counselors and therapists. There's a whole range of people. And for registration requirements, what we're saying, what we're looking at, and what is now part of our draft registration regulation, is the minimum education requirement for that group would be a 2-year diploma from a community college. That's a minimum requirement. That would include a supervised comprehensive practicum. And they wouldn't have to have the one-to-one client contact hours. They would also have to have this demonstration of use of self-awareness in the therapeutic relationship, and they will have to write the registration exam. But there's quite a difference between the two groups. The other group we see more as independent practitioners, working one-to-one with clients, often in independent practice, often on a long-term basis, not always. So the registration requirements will be quite different.
Thank you. We are a professional association as well. We are, to become a clinical member, you need to have a graduate degree from a recognized university, psychology, counseling, social work, medicine, divinity, humanities, or a program substantially similar. We anticipate, as well as having, as I've already talked about, our own individual psychotherapy. So we anticipate all of our members being able to become registered with the college. But we are a professional association, but we are not registered as it stands right now. But we do anticipate all of our members being able to become registered in our colleges.
There's one other thing I should probably mention, and when I talk about the diversity of training and education programs, backgrounds of future applicants to the college, also included are a group of psychotherapists who have trained through a non-traditional route, if you like, because they've been trained outside the traditional college and university system of education. They would say actually that their training as psychotherapists is via the traditional route, which is rooted in the European tradition actually, and there are what are commonly known as private training institutes or institutions that provide training for psychotherapists. I think we're going to be calling them independent psychotherapy training programs. And that one of the reasons why we are not going to be asking for a specific degree, a very specific degree, is because the intention is, and the Ministry of Health is, I think, somewhat anxious that that we do include or provide a mechanism for people that have obtained this kind of training to become registered with our college. And that's going to be a whole process in itself, assessing which of these programs, meet our standards, let's say. Some of them are very lengthy and